ALS can cause changes in the ability to chew and swallow. We call this a dysphagia. Signs and symptoms of a dysphagia include coughing or choking with eating or drinking, getting food or liquid stuck in the throat, or having a wet voice after eating or drinking. Complications of a swallowing problem can include dehydration, malnutrition, and risk of aspiration pneumonia. Aspiration pneumonia is when food or drink gets aspirated into the airway and bringing down bacteria, which can lead to pneumonia. The speech-language pathologist at ALS Clinic will provide strategies to help your loved one chew and swallow more safely and efficiently. They may recommend diet modifications such as softening foods, blending foods, or thickening liquids. If your loved one is unable to safely eat or drink by mouth, they may recommend a feeding tube in combination with your medical team. A feeding tube is an alternative way of getting nutrition that is not by mouth to reduce the risk of getting an aspiration pneumonia and to help support your loved one's weight, nutrition, and energy level. At this time, we don't have good evidence that exercises can strengthen the muscles for swallowing and voice in ALS. There is also risk that you could exert the muscles, which can cause further weakness. This is something that you can discuss further with your speech therapist and your neurologist at clinic. One misconception is that if your loved one gets a feeding tube placed, they are no longer able to eat and drink by mouth. This is not true. If your loved one has a feeding tube placed, they can continue to eat and drink by mouth if it is safe and they have the desire to do so. For example, I have some people with ALS who choose to put pills or medication through the tube because they're difficult to swallow, but they continue to eat and drink the foods and drinks that they want to by mouth. ALS can cause changes in your loved one's ability to speak and communicate. They may develop something called a dysarthria, which is a speech disorder caused by a neurologic condition. Signs of a speaking problem in ALS include slurred speech, slowed rate of speech, hoarse or strained vocal quality, breathy sounding voice, and decreased volume. They may also develop weakness in their breathing muscles that contributes to voice changes such as decreased energy with speaking. It is essential that your loved one continues to have the ability to communicate as the disease progresses. If they are having speech changes to the point where they're not understood by their natural speech, your speech-language pathologist may introduce something called alternative augmentative communication, also known as AAC. AAC can be anything from low-tech tools such as writing in a notebook, using a letterboard, or it could be a little bit higher tech, like using a smartphone, putting an app on your smartphone to communicate. There's also something called high-tech AAC. This includes use of a speech-generating device. A speech-generating device is a computer or a tablet that somebody uses to communicate with. They can access that device using their hands, so touching the screen and spelling out words and phrases that they want to communicate. Or if the person has decreased strength in their hands or arms, they can access that device using their eye gaze. The speech-language pathologist at ALS Clinic can help with something called voice preservation. What is voice preservation? Voice preservation is the saving of one's natural speech to be used onto a talking device if needed, if your loved one experiences changes with their ability to speak naturally. There are different processes involved with voice preservation. One of them is called message banking. Message banking is the recording of phrases, stories, and meaningful information onto a voice recorder. These recordings can be put onto a talking device so that your loved one with ALS can access them and use them to communicate, and you get to hear their voice. There's another process called voice banking. Voice banking is the creation of a synthetic voice. It's not going to sound perfectly like your loved one's speech, but it's pretty close. You can put that onto a talking device as well, and your loved one can use that to type out new messages. There's a new form of voice preservation called AI voice cloning. AI voice cloning is using recordings of one's speech, and this can even be before the diagnosis when there were no speech changes. And the AI voice cloning process creates an AI voice. This is unique from voice and message banking because it truly captures the intonation and uniqueness of your loved one's speech, and it's very realistic sounding. I know it's hard to talk about this early in the disease process when your loved one may still have intact speech. I've never had a person with ALS regret doing voice banking, message banking, or AI voice cloning. However, we have had people with ALS regret not doing it. So be proactive. Start early and work with your speech-language pathologist at ALS Clinic. They can connect you with resources and organizations that can provide further support for using speech strategies, communication tools, and voice preservation.